All right, and action. So, Nate, welcome back to our office. We appreciate all of your patience in helping us complete those exams. They're really important to help us understand the case that you're coming in with and to build that clinical picture.
Okay.
So, after I was reviewing your case, it looks like you have what's called upper cross syndrome.
Oh, that sounds intense.
Yeah, it's really not.
Okay.
We've had a lot of improvement with patients before with this condition. It's
Okay.
kind of our field house as chiropractors because it deals with muscle patterns and structural dysfunction. So it's a fancy term for bad posture and the effects that come with that. So it affects a lot of people in this modern times because we're constantly on our devices, we're texting, especially for students. This is really common. You walk into your library next time, just go ahead and look around, and I'm sure you'll see everyone doing this. So when that happens, when you're over in a posture like this, these muscles in front get really tight, and your head is like as heavy as a bowling ball. And when it sits on your spine and it goes forward, all of these muscles behind your neck have to tighten to make sure the structure is kept intact. And so what's going on is it's getting really tight up here, really tight in front, all through this area, and the muscles that are supposed to be working to help bring your shoulders back are weak. And the muscles that are supposed to help hold your neck up in the front are weak as well because you're disabling their action when you're moving forward like that. So basically how we attack this is adjusting. We're going to help mobilize those areas in your spine that have been stuck in a position. So that's going to help retrain your muscles as well. We're going to do some therapeutic exercises and stretches to help retrain those muscles and movement patterns so that you further on learn how to properly sit and have your workstation. So we'll go into ergonomics of how to make studying.
What?
So ergonomics, which is basically a term for the proper movement of proper functioning of the structure. So that's like a really base definition, but what that means for you is we want to create a studying environment that is conducive to help your spine. So we as humans are not meant to be sitting for long periods of time, hunched over, and so what we'd like to do is bring your devices up, have your books set either on a pedestal or stack some books so you're at eye level, and then making sure to move around once every hour for just even a few minutes to help get the blood flowing, to help improve circulation and hydration to those muscles. And so your diet is really good. Probably could drink a little bit less coffee, but we can talk about nutrition along the way if that interests you. But yeah, so we'd like to do some stretches, therapeutic exercise adjustments. To see the best outcome, we recommend coming twice a week for the next 2 to 3 weeks. And then at that time, or even before then, if you're starting to get better faster, we'll do what's called a re-exam, which is basically a very short version of what we did when you first came in, just to reassess how you're improving and, taper that down for the future, and then hope to maintain that. So our goal is to help your body heal itself and to learn how to move properly, and as well to heal itself from the inside. So as our jobs as doctors of chiropractic, we're just here to help guide your body into the right way to function. Everything you have is within you right now. We just kind of help bring the knowledge back. So let me see. You could definitely not get treatment. It's up to you to do this. You could always take over-the-counter medication, do no treatment, or go see a massage therapist. You could see your primary care physician for some pain meds or, other alternatives. That's definitely an option. But we pride ourselves on being conservative care specialists. So it's the least invasive and it helps you in the future for the long term. Benefits of chiropractic, I mean, I spoke about that, like your body is just going to be able to heal faster, heal better, and function better, and you'll be surprised at how well you'll be able to study and maybe even longer if you just give your body just a little bit of time to help recuperate after those long study sessions. And adjustments are amazing for students. I was a student for many years, and it definitely helped me. And some risks for chiropractic, because we're going to be adjusting the spine, the back, and the low back is, especially with your history of high blood pressure, there is some risk of stroke, but it's very minimal. And after performing all of your other exams, it's not a vascular issue. It's more of a muscle hypertonicity issue. And so we're required to tell you about that, but it's about as common as, or you have as much risk as if you went to go get your hair cut and you leaned back a weird way. So it's really very conservative, very in tune with how the body should move. We're not going to be putting you in positions that are not comfortable. And we'd like you to tell us if you ever do feel discomfort. We want to respect your space. Yeah, do you have any questions so far?
Yeah, how much is this?
Yeah, so we charge a going rate of $5,000 per adjustment. Just kidding. We offer very affordable care, and we do packages for about 12 visits for $300, and that allows you to come more if you need to, if you have exams, or less per month. So feel free to get that, and you can cancel at any time. This just allows you to save a little bit of money, because if you paid out of pocket, it would be about $80 per visit for just the adjustment. So I like to recommend that, because it's a great special we have at our practice to help bring people, making sure they stay accountable and they come in for their visits, because we don't want to just one adjustment done, like we want you to stay with the course and make sure that you are doing your exercises and get the proper guidance.
Okay.
And like I said, like towards the end, we have different memberships for different conditions. If once you're on a maintenance condition, that's up to you. You can come in once a month, once every 2 months. That's to help maintain what you have.
How long does it take for me to get from coming in, 2 times a week to that once every few months?
I mean, that's all based on you. I mean, there's a lot of variables that come into how quickly people get better. Your age, you're very young, so that's a plus. We as well look at your health. You said you're vegan, so you're making sure to eat a lot of fruits and vegetables to help reduce inflammation in your body and improve function. So that also is a plus. You don't drink any alcohol, and you're physically active. You do play a lot of basketball, and it seems like you enjoy that, so you have some stress relief. So all in all, the only thing that's really against you is your studying and how you are holding yourself in those positions. So once we help educate you, I believe that your body will adapt fairly quickly. Okay. It's a little bit different if you had to have a scorecard of, your prognosis versus someone who's, obese, who has on like a lot of medication. You would have a score of like an A. They would have, a score of like a D. So in those cases, they need to be coming in more, because there's a lot more at risk or a lot more in the game. So, any other questions?
No, I think you answered them all.
Let's get cracking.
Sounds great.